You can act when someone ODs. There are 5 steps to follow when someone overdoses. 1. Try to wake them up. Start by yelling their name and telling them you're calling 911. If they're still unresponsive, do something painful like grinding your knuckles hard on their sternum.
If they wake up, try to get them to talk and walk around. Keep them awake and keep an eye on their pulse and breathing. If either of those seem abnormal or they can't stay awake, call 911.
2. If they don't respond, call 911. Even though naloxone can reverse the symptoms of an opioid overdose, they need medical care to fully recover. There can be serious complications after ODing. When you call 911, share your exact location in as much detail as possible. Describe symptoms to the dispatcher on the phone, not that it is a drug overdose. Describe symptoms like not breathing, clammy, unresponsive, and blue lips. Try to limit background noise when you call. Police might be sent if it sounds chaotic. Tell the paramedics everything when they arrive, what drugs the person may have been using, and anything else you know about their condition.
If you absolutely can't call 911, do what you can to reach help. Can someone nearby call? Can you follow all the other steps and then go find someone to call? Can you at least leave the person where they can be found quickly? Try to help as much as you possibly can.
3. If they may have taken an opioid, give them a dose of naloxone. Naloxone is sold over the counter or available by prescription directly from pharmacies in most states. The most popular form of naloxone is a prepackaged nasal spray. To use it, hold the device with your thumb on the bottom of the plunger and your fingers on either side of the nozzle. Then, just stick the nozzle all the way up one nostril until your fingers are against the bottom of their nose. Firmly press the plunger to give the dose and then remove it from the nostril. After the first dose, begin rescue breathing but keep track of time. If they don't respond in 2 to 3 minutes, administer a second dose of naloxone. 4. If they aren't breathing, provide rescue breathing. Rescue breathing requires that you place them on their back, tip their head back to straighten the airway, and remove anything blocking their airway. Pinch their nose and put your mouth over theirs and form a seal. Start with 1 to 2 normal-sized breaths into the mouth, then give 1 breath every 5 seconds. If they don't have a pulse and aren't breathing after the naloxone and rescue breathing, they need CPR. If you're not trained in CPR, call or stay on the phone with 911 and the dispatcher can walk you through the proper CPR procedures until help comes. 5. When the person starts to breathe regularly on their own, roll them into recovery position. Recovery position keeps their airway clear and prevents them from choking on vomit. Lay the person slightly on their side and bend their knee to prop them up. Place their hand under their cheek to support their head and keep their airway clear.
The effects of an overdose can last a long time. Well, naloxone only lasts between 30 and 90 minutes. In some cases, overdose reoccurs after the naloxone is worn off. So it's important for a person that's overdosing to receive medical care. If this is impossible, then someone must stay with them in case another dose of naloxone is necessary.
The person may also feel like they're having withdrawal since naloxone blocks opioid receptors, so they might want to use again, but that could cause another overdose. Support them in not using in the hours after their OD. Know the facts. Protect yourself.